COVID-19 in Shelby County. Yesterday, we received reports of 35 additional cases, which brings us up to 170 cases in Shelby County. Continuously, the data indicates to us that there's transmission that's occurring in the workplace, so I'll reinforce my previous recommendation about assuring that people who are ill stay out of the workplace, and that individuals who are ill remain home. The other thing that we wanted to do today, we have been working diligently to be able to look at data from different perspectives to give a more complete profile of COVID-19 in our county. That's not always been easy because these are new data streams for us. There's been changes at the state, but over the last few days, our EPI team has worked diligently to try to get some of that information together so that we can, again, give a more complete profile. So I've asked David Sweat, who will come up here in a few minutes, who's our Chief of Epidemiology, to give a little bit more insight on the scope of the issue in our community, some of the specific demographics, but also to kind of go over a few things that his team is doing to make sure that we're better able to understand the issue here in Shelby County. So I'm going to turn it over to David.
Good afternoon, everyone. As the director mentioned, we have been working to get the data in the system so that we could begin doing some analysis of that data. Just to give you a sense of the challenges around some of the data, we've had 120 cases reported to us in the last 3 days. So we are still investigating a lot of those cases. But as we put the information into the computers and are able to begin to crunch the numbers and learn some things about the way this epidemic looks like in the Shelby County area, we have learned a few things. So far, we've learned that, like was stated earlier, we're up to 170 diagnoses locally. And while what that means in part is that although testing remains something that we would like to have more access to and a greater capacity to perform in our healthcare systems locally, people are able to be tested because 170 people have been tested and tested positive. Many more have tested and tested negative. Then the other thing that the data tells us so far is that 74% of the people who have been diagnosed as a confirmed case of COVID-19 in the Shelby County area are less than 61 years old. So they're 60 years old and younger. 38% of the people who have been diagnosed are between 21 and 40 years old. So one of the narratives that has been widely spoken throughout this pandemic is the risk to elderly folks and that younger people are less at risk. What our data, though, is showing that may be true for the worst outcomes. Certainly for fatalities or hospitalizations, the younger population may not be experiencing those outcomes at a high rate, but there's definitely diagnosis, there's definitely transmission occurring at younger age groups, and that is part of why the mayors locally have issued orders like the stay-at-home order. Is we're trying to starve the virus of new hosts by emphasizing our social distancing strategies and slow down the progression of the virus through the community. So at that, in terms of our other main work, is we're investigating cases, identifying contacts to those people who have been exposed, then getting in touch with those contacts and telling them their instructions about isolation and quarantine so that they're aware of what they need to be looking for, but they're also aware of the need to stay home so that if they do begin developing symptoms, they're not in the workplace or in the community sharing the virus with other people. So that's the bulk of what we're doing right now.
Thank you. And we're going to have everyone available to answer questions. I also wanted to give Dr. Bruce Randolph an opportunity to speak. He's our health officer. And together we're issuing a health directive, and so I thought it would be good for you to hear from him about the health directive and a little bit about his role. Thank you.
Good afternoon. So I'm the health director of Shelby County Health Department. And with that, I'm given the authority to issue a health directive. And effective today, I am in collaboration with Dr. Househalter, the director of Shelby County Health Department, is issuing a health directive. This health directive is designed to preserve the health and safety of all citizens in Shelby County. It is a it is consistent with the directive that the mayors have already issued, or the orders that the mayors have issued. I feel the need to issue this because it will cover not only the municipalities, but also the non-incorporated areas of Shelby County. And under this directive, non-essential businesses and workers are asked to shelter in and to not be out unless absolutely necessary. And this is an attempt to still try to control community spread. I think we have a narrow window, and if we act together and if all the citizens will combine with what we're trying to do and cooperate with what we're trying to do, we may be able to prevent the overwhelming of our healthcare system and somewhat blunt the spike that we are anticipating with the cases. With that, I will entertain any questions that you may have pertaining to this directive.
We're gonna try to keep our 6-foot distance and answer questions, so it may take a minute for us to move back and forth, but we'll open questions.
So Dr. Randolph, is this really to include the unincorporated areas in the county in the directives that most of us are already under?
Yes.
How many people, do you have a sense that this?
No, I do not have a sense of how many people, but it would apply to all citizens in Shelby County.
Is the list of essential and non-essential businesses, is that consistent with Mayor Strickland's?
Yes, it is.
I have a question for Mr. Sweat. Hospitalizations, how many of the people who've been diagnosed are currently hospitalized?
I don't know the number that are currently hospitalized. What we believe is that 5% have been hospitalized. Some of them have been released, but 5% is representing about 10 people so far. That is something that is discussed in daily calls that you may have heard about that occur, the task force for county and municipal mayors and all the governmental agencies and emergency response agencies in the county. So that's the number that we've heard so far is about 10 people or so, about 5% of those diagnosed.
David, I think we've heard this so much, and everyone has said, we all know that older people are more susceptible, as you said, to the worst outcomes, serious illness. And a lot of these orders really have come about as younger people in past weeks we're still seeing congregating, being together. I think a lot of people, when they hear that 38%, almost 40% of the cases are people between the age of 21 and 40. As a general thought, those are people that are the most active, the most healthy. I mean, this is really affecting that group of our population here locally.
Exactly. That's the point I was trying to make, is that even if that population is less likely to experience the worst outcomes, they may be driving transmission. And of course, those people are related to and interact with people who are at higher risk. And so the whole idea of social distancing across the whole county is to protect those most at risk by lessening the amount of contact they have with those who may be transmitting the virus.
With the better numbers on the demographics, are you closer to a ballpark number on the total number of people who have been tested? I know the state is using a new database with that, and you talked about that earlier. But are you closer to a ballpark number?
The state is working on a report to help us get that number. They're reporting it at the statewide level, and they've been working on a report that will generate those numbers for us at local levels. Unfortunately, that report just isn't quite working right yet, but we hope to have those numbers shortly.
Is that
And
total
is that a
tests?
function of the fact that you've got public entities and you've also got private hospitals, and you want to be able to include all of those together?
Well, all reportable diseases are reportable by law. Laboratories must share their information with the state, but that's what the statute says. They have to share it with the state.
You only have to share positive.
And they only have to share positives ordinarily. The state has requested for this disease that they also report their negative tests, but once again, the data is flowing to Nashville, it's flowing to the state. And so until they've processed it and returned it back to us, we're not entirely sure what it says.
Do we have any sense of, Dr. Haushalter mentioned this the other day, I think maybe when we think these cases will plateau and hopefully go down? Because and what would be your message to the community? We've gone from 10 Thursday to 170 today. Is that, should that cause alarm for the public, or is that just more of a byproduct of we're getting batches of test results coming in daily?
We can all respond to that one. I mean, it's alarming to us. And I think this is consistent with what we've seen in other communities, and by doing the daily press conferences and getting information out, we're hoping that the community understands it's having a significant impact on our community, but that impact is gonna grow greater over time. So we really hope that people will take all the actions that they can to prevent transmission, and particularly to prevent transmission into the groups that are most vulnerable.
And we're also seeing today, just since yesterday, an Amazon worker tested positive. We're hearing a pastor potentially did. Could you just reiterate? We're dealing with people who are on the first wave, correct, and the risk associated with that.
Yeah, so reinforcing this is transmission in the workplace, or people are traveling and bringing it into the workplace, because it is age groups where people are still actively working. What we don't want to have happen is that to be taken home to our seniors, or to be taken to the nursing homes and the hospitals. And so it's important that everyone of all ages take action. This is not limited as far as our response to any one group. We all have something that we need to do to make an impact here. I know you've had a question, I don't mean to point, but go ahead.
Those who are in the hospital, how critical is it, and any of them on a ventilator?
So one of the things that we're trying to do is actually get more information. We had a meeting this morning to see how we can get reports from the hospitals daily to make sure that that number is more accurate. You know, I've said every day I don't have a number off the top of my head because it wasn't necessarily an accurate number. So we're trying to see how we can work with the hospitals to know every day how many patients they have in-house that have a diagnosis or a suspected diagnosis, whether they're in the intensive care, and whether or not they're on ventilator. But one of the things you have to keep in mind is this is now in a younger population. They're less likely to have those severe outcomes. As we begin to see another wave that impacts our senior population and those with chronic illnesses, that's going to grow exponentially, and we have to be prepared for that.
What makes a liquor store an essential business?
I'm sorry?
A liquor store, what makes that an essential business for them to still be open?
Because they do provide a sales service to individuals who may be of need for bars, restaurants, or others that have takeout service or other limited things.
We mentioned this yesterday, but it bears repeating again. We've heard and saw, I believe Regional 1 announced to employees tested positive that they had some enhanced screenings. We've had other healthcare workers, some, emergency service personnel on the front lines. You mentioned that is a real concern when we start seeing those frontline workers testing positive, and we are seeing that now. What's the next step in trying to blunt that so that this does not get into those systems, police, fire, nurses, doctors, that we don't need to get infected?
So a couple things. One, and David mentioned it earlier, around our contact investigation. So it's really important that we get the reports from the laboratories very quickly so that we can do contact investigations, identify others that are at risk, and put them in quarantine very, very quickly. The other is the message that I've been saying for many days now. It's really critical that individuals do not go to work when they are ill with fever or any upper respiratory symptoms or flu-like symptoms. Consistently, as our team are doing contact investigations, individuals in a variety of professions, I'm not focused on one specifically, continue to go to work while they're ill. And that's a critical message, because if we're ill, we're more likely to transmit the virus, and that includes frontline healthcare workers. The other is when you see frontline personnel who are interfacing with individuals who are very high risk. So if you have nurses or other healthcare providers, EMS, fire, police, or whatever, they're actually going to interface with the most vulnerable populations, and it's important that we stop transmission, one, amongst those personnel, but also to the people they serve. And lastly, if it's spreading in those populations, we are going to deplete our workforce, because you have the individual who's ill, but also all of their individual contacts will be quarantined, and we need our first responders to be able to respond. We'll break one more.
The hospitals have been saying that they are giving their test data to the county health department, but we can't get it.
So that's not accurate. What the hospitals give us are their positive reports, only consistent with state law. And as I noted last week, we had one system that did not provide the reports. They thought somebody else was providing their reports, and we got a batch of them in at one time. So there's, the way the state law is that is the healthcare provider, the laboratory, a pharmacy, or anyone who knows of a potential infectious illness has to report that. So they're reporting their positives to us, not the total number of tests done. That is being reported by the labs to the state. And we understand the importance of having the total number, as well as those positives for that positivity rate, but we're not going to release information that's inaccurate.
Do you think it will still take, like you said the other day, it changes every day. Do you still think we might have a plateau peak of cases in 2 weeks? Do we have a broader idea on when you hope it might peak? And also, follow-up question, the pace we're going right now, is this worse than you feared in terms of where we're going? Do you have any broad takeaways of where we are right now?
So I won't say it's worse than I feared, or we can look at other communities and know that there's a doubling of the number of cases every 5 to 7 days, so that's what we've anticipated. And have continued to try to stay focused on what are the things to do. Honestly, I don't come to work in fear. We have a lot of people dedicated to address this issue across the city, the county, and multiple municipalities. So it's about staying focused on strategy and using data to drive our decisions. From my perspective, I've been consistent that I think it'll take 2 to 4 incubation cycles to be able to see the impact of some of these interventions. And that means 30 to 60 days. Some others may have a different perspective on that, but we can look to China and some other countries that have implemented very stringent measures, and it really was about the 60-day mark where they began to see impact based on the decisions that they've made. So I'll give you one more, because I know we didn't need to. So go ahead.
What do you say to those families who are scared as we continue to see these numbers rise?
Is it's really important that we stay focused on what are the things we can do positively to reduce spread. And those, again, are basic things: hand washing, staying away from crowds, staying at home. And then also recognizing that 80% of the people who become infected recover and do quite well. You have another 20% that may have some symptoms and a smaller 5% margin that are going to end up hospitalized, and then about 2% that are going to have severe illness. So that if we work together collectively now, we can reduce those numbers over time. So I want to thank you guys again for being here. We'll be back here tomorrow. Again, this week we'll just do it Monday through Friday. Thank you. Thank you for being our sign language